Right now, we're going to take a closer look at a new rule that just became active here. So it's going to be impacting Georgia doctors who prescribe controlled substances through telehealth or virtual visits.
Brittany Klein-Peter joins us now in studio with some information to help explain this change. Brittany, a lot of people have come to rely on those telehealth services. So how is this going to impact them?
Good evening to you both. So the Georgia Composite Medical Board recently made this decision to return to pre-pandemic guidelines, which essentially makes it harder for doctors to prescribe drugs like Adderall, Ambien, and even cold medicines like Robitussin AC. Those are all considered controlled substances. So the rule actually states that doctors are not authorized to prescribe controlled substances for the treatment of pain by solely electronic means. But doctors can prescribe a drug for a patient they have a valid relationship with according to the law. I spoke with a doctor who tells me the wording is somewhat confusing, but he believes this predominantly impacts new patients and not patients who have already met with a doctor in person and now do telehealth visits.
My understanding that if the provider has an established relationship with the patient, it's a patient they've seen for quite a while, they've had in-office visits with the patient, and the patient needs a visit to renew a prescription, it's my understanding that that is okay. Now, I need further clarification on that. So as far as I'm concerned, for all my patients that are taking controlled medications, they will have to come in until I have full clarity.
I just heard back from someone with the Georgia Composite Board within the last hour and a half, and they told me the decision does not forbid teleprescribing, adding that the board is meeting tomorrow to discuss further feedback they've received regarding this decision.